Hi Yogi Moms, it's Dr. Lauren Luke, and I'm here to chat with you about what to expect in prenatal yoga. It's not just yoga poses. There's lots of education, and it's birth preparation. So I just wanted to go over first about the pelvic floor and your core muscles because your pelvic floor and your core are supporting the baby while you're pregnant, and they also have a role in birthing. So we're gonna talk a little bit about the birthing, but first we're gonna talk about why it's important to be able to activate your pelvic floor muscles when you're pregnant. So one of the reasons is that they support your baby. So if you feel a lot of heaviness down in your pelvis when you've been standing for a while, sometimes it could be that these pelvic floor muscles aren't activating right. So that it could be that they're very tensed and tight, or it might be that they're just not recruiting like they should be. The other reason why you want these muscles to be able to be active during pregnancy is because they support your pelvis. They go from your pubic bone here, which is one of your pelvic bones, your pubic bone here to your tailbone here. And then they also attach to your hip bones, which I don't have the hip bones right now, but they attach to your hip bones right here. So they're providing a lot of support to your pelvis and hips and your low back. So if they're not activating the way they should, you can have a lot of low back pain, hip pain, and pelvic pain. So that's why we're going to be working a lot on the pelvic floor and prenatal yoga for the moms that are having this pubic symphysis pain, or maybe some pain in their lower back. It could be because these muscles are tensed and tight, or maybe they're not recruiting well. So we're going to be doing lots of poses to help lengthen and strengthen them, okay, to create more of a balance and get them recruiting better to support your back, hips, and pelvis. So we want them to be really turned on and working really well when we're pregnant. However, when we're trying to birth a baby, it's not about the strength of your pelvic floor. So here's I'm busting this myth, is that you need a strong pelvic floor to birth. That is not the case. What you need is a strong mindset, especially if you're going to birth naturally. And you need a strong uterus. Your uterus is a muscle, and your uterus pushes the baby out, okay? Your uterus pushes the baby out. Now, if you do have an epidural, which is perfectly fine, sometimes that signal is a little bit diminished to the uterus, and so you have to do a little bit more pushing on your end to help the baby come out. You might have to create more pressure down into your pelvis to push the baby out. However, the uterus is still trying somewhat to get your baby out, okay? So what it's about as far as birth, what we need our pelvic floor to do during birth is relax. So we need these muscles to relax. From the belly button down, your muscles should relax to get the baby out. Now, up here in our upper abdomen, we can kind of bear down a little bit and create pressure, but we also have to learn how to relax our pelvic floor, and that's what we're going to be doing a little practice in yoga. And of course, if you need one-on-one sessions with me, birth prep, which I usually suggest at about 34 weeks, we go over perineal stretching to reduce your risk of tearing, and then efficient pushing. And so I get my mamas on my ultrasound machine, and they can actually see their pelvic floor when they're pushing. Okay. So it's a really cool tool. And, if that's something that interests you, definitely reach out to me. Again, at about 34 weeks is typically when I suggest us getting together one-on-one. So hopefully this helps, and I'll have this pelvic model on Sunday. And of course, I'll be there to answer any of your questions after yoga about the pelvic floor. So look forward to having y'all. I'm excited about Sunday at Hilltop at 1:30. Okay, bye.